Hello there, folks. Welcome to my brain wreck. Hope you guys are doing good today. Well, as you guys can see, I don't have my 40-hour EEG amateur stuff on, as I call my zombie apocalypse. So that's good for me, because I was getting annoying. So yeah, I was able to get the glue out of my hair and stuff and all that. And then when I went back, they got most of it out for me. Like used like a soap rinse type thing. Not a soap rinse or whatever, like a baby shampoo. I used to say. Of course, I got in the shower and got the rest out and going through. Now, for you guys that do have 48-hour EEGs, whatever, for me, what I use is like a comb, kind of, I guess you could say, to get it out. Use like a tooth comb. Yeah, I don't care if I ever trim my hair because I'm pretty much bald anyway, so it doesn't bother me now. Yeah, you can feel it pull and trim. It's like, you know, stuck in there. They say use something like a baby shampoo or whatever. Everybody has their own days, how it works. So everybody's skin's different and oily a certain way. So I can see the red in my beard and do like this. Of course, I need to trim and all that good stuff. I'm trimming these side and whatever burned hairs. But anyways, I'll know the results here in a few days, hopefully, and see. Maybe I can go look into my chart and see if it's on there yet or not. I don't think so, because I believe what they do is the doctor there reads it at the hospital, where I went to have it have all my setup and come home and sleep. And yeah, I had to keep a document everything I did, drink water, eat. Not when I go to the bathroom or anything. Just when I eat, or I feel something twitch while I'm sleeping or stuff like that. But so I got that done today, and now on my hair. So what hair I have left, anyways, but it's out. So I'm glad to know. So we'll see if there's anything. Like I said, though, in my other videos, sometimes they don't notice anything at all. Doesn't mean you don't have epilepsy. Just sometimes things just don't get recognized, or maybe they'll see a certain pattern. So when I did do this, I wasn't allowed to chew gum at any type at all. I was also told, not on here, but I've seen where you're not supposed to go to near microwaves or anything, or plug in your phone and use it while you're doing videos or whatever. Not doing videos, but plugging your phone while you're looking at it. Supposed to, but that's different things I've heard. I'm not sure how true that is, but maybe it just depends on the doctors how he feels about it. Electronic stuff, if you're using it, maybe it affects something or whatever with the things. All not for sure, but so I'm here to talk about um, epilepsy and migraines. Are they connected somehow, some way, shape, or form? Well, not for sure. So, as I said, I'm not a doctor. I'm not a medical professional or anything like this. I just do this to pass on information, maybe for you guys to get some ideas and stuff, and maybe you'll learn something out of this. So, if you guys are here for the first time, welcome to my brain wreck. I call this my brain wreck because my brain took a wreck. All right. So, I'll also say people with epilepsy just proves we do have brains, right? So, people with epilepsy do have brains, and we do. All right. Some of us are very smart, you know. Some people think we're just ding dongs, but we're not. Some of us think we're faking it. No, we are not faking it or anything like that. There's no reason to fake it at all. No reason at all. So people think we are, but the reason is because they are not educated. So I suggest that you have that person go educate themselves or yourself if you're not educated about it. And a good place to start is epilepsy.com. All right. That's EPILEPSY.com. So I'll put that into my video here. I always do. So that's where I get a lot of my information from and things like that. So I'll be right back with you in just a second. All right, I'm back. So what I was talking about is seizures and epilepsy, or excuse me, headaches and epilepsy. Do they go together? Well, I'm going to look over here at this information and pass some of it on to you and let you know. All right. So do seizures and epilepsy do they go together? Or do they have interconnecting somewhere or something like that? Do headaches imitate seizures or may look like a seizure, but they're not? Are they actually connected to the epilepsy, to some form of type of headache? So I'm over here just reading off of epilepsy.com in case you're wondering, so I'm giving credit to epilepsy.com where I get my information from. You guys also can go there, but I figure I just do this to pass on information. Like I said, this is information purposes only. This is not for medical advice or anything like that. I'm not a medical profession. My profession or background is in criminal justice. So if you want to know something about criminal justice or anything like that, you can ask me a question on this if you want to on this channel. That's fine. So thanks for here. So if you're a first time comer, thank you. Please subscribe. share with others. And give me a thumbs up, leave a comment, and I usually will come back to you. All right, seizure and headaches. It says they don't have to go together. So it says everyone experiences a headache, which we all had time one or another. Obviously, I've had it very rarely though. So as you guys know, I do have internal seizures. I've had 3 of them. The last one almost killed me. I was intubated or whatever, and didn't come to until the next day. So thank God that I'm still alive. And I always pray to God all the time. I'm of a Christian faith, so. But if you have epilepsy, your chances of suffering from headaches are greater than average, obviously. So headaches may occur before seizures, and are common after tonic-clonic seizures, which I believe mine are tonic-clonic because they're nighttime seizures. So in rare cases, the brainwave changes seen on an EEG show that a headache can actually be the only symptom of a seizure. So if you have a seizure disorder, you're twice as likely to have a migraine headaches. All right. So obviously you're gonna have twice as likely to have migraine headaches, which that makes sense. With seizures and headaches, your headaches are very intense and stuff, and you have been diagnosed with some type of seizure disorder. So your brain is somewhere pressure here, and tension headache, stress headache, just that headache. Adding worries about having a seizure to your everyday stress may increase your chances of having an uncomfortable tension headache, as I just mentioned. So now this says, when do headaches occur with seizures? Well, it says after. The most common headache associated with epilepsy is called a postictal headache. Postictal headache, meaning that the headache occurs after seizure activity. It is estimated that 45% of people with epilepsy have postictal headache. All right. And most frequent occurs after tonic-clonic seizures, but can also follow focal alert and focal impaired awareness seizures. That's very interesting. So the pain of a postictal headache is widespread. It can be steady or throbbing, and intensity can range from mild to severe. These headaches usually last between 6 and 24 hours. So a lot of you experience headaches and stuff like that. And especially women. I believe women get headaches way more than men, obviously, because their brains are obviously made different than ours, than men's, of course. So they function differently, or sometimes even longer. They may be quite disabling, causing you to lose additional time out of your normal activities, obviously. So what's before? Well, before, less commonly, a headache may be a sign that a seizure is approaching. These headaches are called pre-ictal because they occur before the seizure activity starts. They are one type of aura. Okay, so it's an aura. It's like an aura you get about something, like something's going to happen. You don't know when though, but you feel something's going to come on. You don't know the exact time or anything like that. You're just waiting and trying to time it out, and and people that have auras and stuff, usually most of them that have had them all the time or quite a lot, will get themselves to a safe spot, where they can be safe and not hurt or bang their heads anywhere and things like that. So the symptoms that warn of a coming seizure, aura. So headaches are generally brief, sometimes, as I mentioned before, they can be 6 to 24 hours. And they can be throbbing, steady, or sharp. Pre-ictal headaches are said to affect about 20% of people who have seizures that are difficult to control, but they may be underreported because the seizure may interfere with memory of the headache. So for those that have seizures and stuff, and for those people you're not sure or whatever, new to this, whatever, and what happens is when you have a seizure stuff, you're not going to remember anything at all. You're not going to remember what happened beforehand or anything, because the memories that you've are new memories are already taking up that space, and those other memories are just gone. You don't remember anything. But sometimes, eventually, later on, maybe a few months after stuff, you remember certain things, maybe, possibly. And I'm not for sure of that. I'm just, because I know I remember a few things, but other than that, I don't remember too much. But they may be underreported because the seizure may interfere with memory and headache. So, types of headaches with epilepsy. Well, one of the most common type of headaches are migraines. So a lot of you people out there that have migraines, obviously, and those with epilepsy or some type of seizure disorder. Now, just to remind you, seizure disorders and epilepsy are two different things. You know, there's seizures that occur with an epilepsy. So you guys can look that up. What's between the seizure disorder and epilepsy or whatever, so forth. So there's things like Dravet syndrome and so forth. Another fairly common type of headache is the migraine headache. If you have migraines, they can make you quite miserable, honestly. Do they have pills and medicines and things like that with that? Yes, they do. I'm sure you guys have seen the commercials and all about that. So basically, they have pulsating pain on one side or both sides of the head, usually accompanied by other symptoms such as nausea. You may feel like you have to vomit or sensitive to noise or light. So you may make, you need to turn your light off in your bedroom or living room or kitchen or whatever. So about 30% of migraine attacks are preceded by an aura, which may consist of seeing zigzag flashing lights, distorted visual images. So I'm not sure if you guys have seen that. Distorted or zigzags of stuff, flashing lights. Blind spots or feeling numbness in your parts of your body, like maybe here by your chest and stuff. Right, your chest here and here, and most times it's usually up here by your chest, I believe. People who have migraine headaches may only have one a year or may have one every day for several weeks at a time. So for those people that have that several weeks at a time, I'm very sorry. I've never been through that. So like I said, I very rarely get migraine headaches or anything like that. So basically, migraines do share common features with epilepsy. Like seizures, they can be triggered by stress, fatigue, menstruation, and alcohol. Now, a lot of people don't know, alcohol actually can affect your brain and make it, get your wires crossed and stuff too. Also, for those out there who have been heavy drinkers and stuff like that, and I know a lot of you guys don't realize it, if you have an alcohol disorder or anything like that, and you guys don't want to be an alcoholic disorder or whatever, or drinking problem, your brain is actually shrinking, all right? But it can be reversed, all right? So for all those that are out there drinking this stuff, your brain is starting to shrink and shrink and shrink. Even though you don't notice it, it's a little bit at a time. They can see that on brain scans and so forth. So an aura before migraine is similar to an aura before a seizure. All right. Even the brain activity detected by an EEG may be similarly abnormal during a migraine attack and a seizure. There's some debates, but not among doctors. No, each doctor's going to have their own thing, what they think or theory. Because doesn't mean they're not wrong. Maybe they all came to their own conclusion how they think it works and how maybe the epilepsy and migraines are not connected at all, but some do think it is during a migraine attack and a seizure. So there is some debate among doctors about whether migraine headache can lead straight into a seizure and be considered a pre-ictal headache. So always there's some debates about that. Okay, and once again, this is just for information purposes only that I'm telling you about. All right, to pass on. And like I said, I get a lot of my stuff from epilepsy.com. All right. So I do give reference and credit to the people from where I get it from. All right. Because like I said, I'm just passing this on to information and try just to make it a little bit shorthanded to you. I'm not reading the whole thing here, but some of the stuff. All right. So, well, most of it, but. So headache as a seizure symptom. So a rare type of headache in people with epilepsy is the ictal headache. These headaches are actually seizure symptoms. Some sound like a migraine, but others are sharp and steady. So in some people, the pain builds gradually, but in others, it begins suddenly. Ictal headaches are seen in all types of epilepsy, including generalized epilepsy. So in a type of epilepsy syndrome in childhood occipital visual epilepsy. So occipital, visual, occipital behind your eyes and stuff. That. In which 20% of children have headache as their only symptom. Often a mistaken diagnosis of migraine is corrected only when the neurologist turns out the abnormal EEG shows epilepsy. So it can be misdiagnosed, obviously, as a headache, but if they look at it the right way, it looks like it is epilepsy. All right, I'm back. As I was talking about, There's a type of epilepsy syndrome in children called childhood occipital visual epilepsy. Occipital, actually, behind your eyes here, I believe. The occipital spot behind your brain up here. I don't even know. I can't go into my brain, obviously, but in which 24/7 of children have headache as their only symptom, often mistaken diagnosis of migraine is credited only when the neurologist determines that abnormal EEG throws epilepsy. So that's something to consider and think about. If your child has something like that, if they seem to have a lot of headaches and stuff like that, if you've been to a neurologist or ask your doctor to give you a neurologist or recommend it for a child, that deals with children with epilepsy or whatever. And more likely, it's probably just going to be a regular neurologist. So now we're talking about how do you treat your headaches if you have epilepsy. Well, according to this from epilepsy.com, stories/seizures and headaches, they don't have to go together. It's the name of this thing on here. I'll highlight it and put it into the description and stuff. Is there anything you can do if you have a problem with headaches? Is there anything beyond an occasional aspirin to help you cut them short or avoid them altogether? Well, that's hard to say. I think headaches can't always be avoided all the time because sometimes people that don't have any disorders or anything like that at all, and they've been healthy all their life, they're going to have a headache once in a while, blue moon, for maybe they've been stressed out for the day or sunlight, sometimes, allergies, allergens and stuff, those can actually trigger headaches. So, which is very interesting. Our environment that we live in or grow up in, whatever, depending on where we live, humidity, non-humidity, dry and cold, wet climates, and so forth. So for me, people, even if you have epilepsy, the answer is yes. Now, headaches, the rare kind that are actually seizure symptoms, will disappear if seizure medicines can control the epilepsy brainwaves. The other types of headaches generally must be treated separately from your seizure disorder. All right. So headaches must be treated separately from your epilepsy, based off of this, from what I'm reading. So now there are two medical approaches to treat your headaches. The first approach is to wait until a headache begins and then stop it. Over-the-counter pills like aspirin, Tylenol, acetaminophen, or Advil, which is ibuprofen, may do the job, or they may not. Sometimes they don't work. Maybe your body just rejects it all at once. Or you may need a prescription for something like naproxen, which, naproxen, you can get naproxen over the counter easily, but maybe those will give you a stronger prescription for it. Or Fiorino, a combination of butalbital, I can't pronounce the name, butalbital, aspirin, and caffeine. I guess the caffeine excites the brain. I'm guessing that's what it's for, and it helps get rid of it. Maybe it releases some pressure or something. I don't know for a fact. I don't know if that's how that works or whatever. That's just how I'm interpreting it anyways. I'm not sure how you people interpret it. Now, for migraine headaches, which involve the blood vessels in the brain, prescription medications called triptans are especially effective. Brand names for various types include Imitrig, Zomig, Emerge, and Mugzalt. I'm sure some of you people probably have seen commercials for that and all that good stuff. The triptans are available in several forms, which when your doctor prescribes will depend on your needs and preferences. Doesn't mean they're going to work, but they might work out eventually. So as you can see, it's hard to determine seizures are epilepsy and headaches. Are they related? Are they connected somehow? So it looks like they might be or might not be. I know there's some other headaches that are, I'm going to have to look it up here. I'll probably look it up and I'll tell you here in just a moment. But I can't think of the name right now. It's on the tip of my tongue. So, anyways, the second approach is to prevent headaches from occurring at all. Your doctor may call this prophylactic treatment for prophylaxis. So in this kind of treatment, you take medication every day to prevent future headaches. The seizures medicines difficult. Valproate is approved for use in preventing headaches and might be the first choice when both headaches and seizures need treatment. So it can work for both, and there may be not. Other medications often used to prevent headaches includes beta blockers, such as Enduril, propranolol, calcium channel blockers such as verapamil and amitriptyline, or Elavil. So sometimes you have to use beta blockers to block out stuff that's getting to your head. I believe. Oh, God, I'm trying to think. Trying to learn my education here a little bit. What is a beta blocker? Keep your blood pressure from going too high, or protect your kidneys or your livers from other medicines that you may take. The thing to remember is that if you're having headaches in addition to your seizures, don't be afraid to seek treatment for both conditions. All right. Treating your headaches probably will not interfere with the control of your seizures, and you'll be free to enjoy your life more fully. All right, sorry, I can't think of the name of the headache. But honestly, they do think somehow, possibly, that headaches could be related with epilepsy somehow, but possibly. Like I said, you can go to epilepsy.com and find that information for yourselves. I'll highlight it, whatever, and give you copy and paste and put it into my description. So, and some of you are wondering, I know you guys have wondered how are seizures classified now. This is from 2017. So, from International League Against Epilepsy 2017. New classifications of seizure types, basic version 1. So, focal onset, aware/impaired awareness, motor, non-motor, focal to bilateral, tonic, clonic. Then you have your generalized onset, impaired awareness, motor, tonic, clonic, other motor, non-motor, absence. So they're absence. Unknown onset, motor, tonic, clonic, other motor, non-motor, absence. All right. So somehow they all going. So the unknown onset would be me. I don't know how, why I got the nocturnal seizures, but I did. Don't know why, but for some reason I did. But anyways, guys, this is all just for informational purposes only. All right. So, and like I said, I did have my 40-hour EEG. I'll probably won't know until after Memorial Day to see what it is. So, if I pick something up, great. If not, well, so like I said, they've been under control for a little over 2 years now. So, if you guys are always wondering, do I have eyebrows? Yes, I have eyebrows. They're just super light, and I guess that's the Norwegian in me. And then there's the beard, my Irish beard. Irish/Norwegian. I should say it's Norwegian too. I'm 38% Norwegian, in case you're all wondering. But anyways, that's not part of this channel. So thank you for watching my brain wreck. If you like my channel, like, subscribe, press that bell button for notifications. Make sure you click all. That way you know I post a video each and every time. Or press down the bottom right-hand corner of the screen there, and press on that little skull or whatever I have down there, the bottom right-hand corner of your screen there, and I'll bring a subscribe button that way. Thanks for watching. This has been my brain wreck.